Hi, my name is Michael and I'm the Principal Chiropractor here at Chichester Chiropractic Health Centre. Today I'm going to be running you through some stretches for your lower back. These stretches are designed to help to regain mobility back through the spine, help to take pressure off the joints in your lower back through your sacroiliac joints, help to get better movement into your hips and to release the muscles in your lower back, in your core, in your legs and in your glutes. Now these should always be done within your comfort zone. If you get any pain, any discomfort, if it just doesn't feel right, please stop and back off. If you're unable to find a comfortable way of doing it, please stop altogether, and when we pick up next, we'll work out why. Otherwise, let's get to it. So now I'm going to show you some stretches for your lower back. Now you want to be able to do these ideally on the floor, on a thick carpet, thick rug, yoga mat, stretch mat, something that's firm but comfortable. Ideally what we don't want to do is to do it on a really hard floor. Now, if you do find it difficult getting on and off the floor, which isn't at all uncommon, then you can do these on the bed and you will still get a good stretch from them. However, my preference is always to do it on a yoga mat or something similar where possible. So for these, we're going to start by laying on our back, and we're going to have our knees just slightly bent, kind of roughly to 90 degrees. And at first, just let yourself relax into the floor. Let the lower back relax, the upper back relax. Just get yourself comfortable in this position. What we're then going to do is take one leg, and we're going to straighten it out, and we're going to flex those toes. So it really helps to keep that leg glued to the floor. We're going to take the hands around the knee. Now, if around the knee is not possible for you, you can take your hand behind the knee. I'm going to show you from on top of the knee because that's possible for me. What I'm then going to do, keeping my head to the floor, is I'm going to take a nice deep breath in and then all the way out. And as I breathe out, I'm just going to slowly bring that knee into the chest. Now, it's not uncommon when doing this stretch, especially for men, is to feel a little pinch or restriction into the hip. If that is the case, let the hip come slightly, or the knee come slightly out to the side, and then pull up and round. And you'll find that this just helps you to go that little bit further. You're getting a very similar stretch into the lower back. And what this stretch is doing is it's releasing the muscles into your glutes. It's getting nice movement into your sacroiliac joints. It's helping to take some of the pressure off the joints into your lower back, stretch the muscles in your lower back, and give you a little bit of stretch into the hamstrings and into the hips as well. So you're going to hold there 10, 15, maybe even 20 seconds if it feels really good for you. Slowly release that off, let the leg come back down. Bring the other leg up, then bring this one flat to the floor. And again, remember, flex those toes. It really helps to isolate this and gives you a nice kind of basis to stretch against. Then take the hand on or under the knee. Again, nice deep breath in. And as you breathe out, slowly and gradually bring that in towards your chest. Hold there 10, 15, 20 seconds. Do exactly the same as you've done on the other side. And then slowly release that off. And come back to center. Now from here, we're then going to bring both knees into the chest together. So knees together, feet together. You're going to bring the hands, again, either around the knees or under the knees. And you're going to pull all the way in. You're going to draw them gradually in towards your chest. Now, when you're doing this stretch, it can be quite nice. Just a little bit of gentle rocking. That's either rocking one knee in after the other, or just gentle rocking side to side, massaging your back onto the floor, and just helping to add slightly different movements into your lower spine. For some, and especially if you've got quite significant symptoms in your lower back, you might want to start with just that gentle pull in. Just get a feel for it and make sure it's a comfortable thing for you to do. Holding there again 10, 15, 20 seconds, and then slowly releasing that off, allowing your sacrum, your pelvis to come back to the floor, then let your feet rest down. Now for the next stretch, we're going to be looking to add some rotation to the spine. Now this is going to be done on both sides, although I'm only going to show you it on one. So for this, what you're going to do is pick your pelvis up and watch I'm bringing it over to one side. So where my left hip is sitting, I'm bringing my right hip as far over towards that side as possible. And then lift the knees up so they're roughly at a 90-degree angle, and let them drop over to the side. Now for some of you, that might be as far as you go at first. That's going to already add a nice twist, nice decompression for the sacroiliac joints and for the joints into your lower back. And you're just going to hold there for a few seconds, just kind of get an idea for how it feels. Now you might find, as you can see with me, as I'm doing this position, my shoulders wanting to come up ever so slightly. Ideally you want to stay as flat as possible, but it's going to be very hard for the vast majority of people to stay completely flat, but that's at least what we're aiming for. So you're going to hold there maybe 10 seconds or so. Then once you're happy that you want to go further, you're going to take this top leg and you're going to straighten it out and just let it drop over. Now, as straight as possible here. Now, obviously for guys especially, but for anyone with tight hamstrings, you're going to find it quite hard to bring that leg completely straight. So you just take it as far as you feel is good for you in the moment. Again, holding there 10, 15 seconds, and then you're going to bring this foot up. You're going to place it either onto the knee or onto the calf, whatever feels better for you. You're going to take the hand around. You're going to grip that side of the knee and just gently pulling that down towards the floor. So you're really increasing that stretch right into the base of the spine, into that sacroiliac joint, into the glutes, and just really taking it that little bit further. Again, you're going to hold there 10, 15, 20 seconds, even 30 seconds this one. It's such a lovely stretch. And then slowly releasing that back off, and then bring the knees back together, bring the pelvis back straight, and then you're going to do the exact same on the opposite side. Now I'm going to show you this again, just so you can see it one more time, saves you going back and skipping the video. So, pelvis across, knees up 90 degrees, drop it over. You're then going to hold this position for maybe 10, 15 seconds, and for some this may be as far as you go. You're going to lift this leg up and out and let it just drop round as far as you can, keeping it as straight as possible. Again, 10, 15, 20 seconds here. Then lift the leg up, place it on the calf or onto the knee if that's possible for you. Take the hands onto the side of the knee and pull back down. 10, 15, 20, even 30 seconds here. Then slowly release. Let the knees come back up. Bring yourself back to center. And that is your lower back stretch is done. Now, just as a reminder, if you get any discomfort, if it doesn't feel right, if it increases your symptoms in whatever way, please go a little bit more gentle with these the next time. If you cannot find a comfortable way of doing these, stop, let your chiropractor know at your next appointment and they'll give you something that's more appropriate. Otherwise, get on with these, enjoy them, and that's twice a day, morning and evening. Enjoy.